Hi, I'm Dr. Greg Kinsing, physical therapist at Function First Physical Therapy.
I'm Donald Allison, physical therapist, assistant with Function First Physical Therapy.
Today, Donald is going to demonstrate 4 different settings that we utilize in our clinic to treat scoliosis. These settings include a side-lying thoracic setting, a supine lumbar setting with scapular rotation, a modified child's pose setting using our red cord setting, and a standing Bowman setting using thoracic rotation and scapular retraction.
And we're also going to show how these exercises can be modified for home use. So you don't just have to feel good at the clinic, but you can also feel good when you're at home also. The first setting that we're going over is the side-lying thoracic setting. What we're doing is we're putting bungee on the thoracic spine, and we're having her shift from a right thoracic curve into neutral. And when that happens, it's going to decompress the discs as well as allow the muscles to relax temporarily. And when we do this, we can also show them how they can do similar stretches at home, followed up by activations to help achieve the same goal.
The red cord system that we utilize is really good because it allows us to strengthen the muscles that have become elongated along the spine and allows us to stretch out the muscles that become shortened. And it really allows us to maintain that neutral position that we're going for after the treatment's over.
I'm going to position your hips. Make sure to tell me if there's any pain. The second setting we're going to use today is a supine lumbar setting with scapular retraction. And this is going to allow us to basically set the lumbar stabilizers and at the same time retract the right scapula, which will pull the thoracic spine neutral, and they're going to get them to hold it there at that position.
And the reason we utilize this setting is a lot of times when you have a C-curve in the thoracic spine, the lumbar spine has to compensate. So it's real important that we engage this spine as well and normalize mobility and activation of the muscles in the lumbar spine while maintaining a neutral position in the thoracic spine.
I want you to blow out as you sit back on your sit. The third setting is going to be the first of the 2 settings that you can do at home. It's basically a modified child's pose using red cord suspension to basically regress it a little bit. But when you push back, you're gonna notice that we're gonna have a right scapula retracted. So it's gonna help counteract the rotation of the thoracic spine while she does it.
The reason this child's pose is so good is because, as Donald mentioned, it really allows that scapular retraction to occur when the rotations become an issue. But it really allows us to normalize the whole spine as one, and when you really go back down into that child's pose position.
Step back, 2 steps. 1, 2. Okay, good. The fourth exercise, we call it the Bowman's. Looks like an archer drawing his bow back. Basically, with this setting, this is something you could do at home or in the gym, but we could also, it allows for that thoracic rotation, but at the same time, scapular retraction on the right side, and it kind of reinforces what we've been doing in the gym all along, but it is something you can do at home as well.
And if you notice that she's kind of leaning back and standing, she's having to maintain a very neutral position all the way down through the trunk. And maintain that position while getting the scapular retraction is very important in fixing the scoliosis that we're trying to treat. For more information on scoliosis or any other treatment condition you may have, you can visit our website at www.functionfirstla.com, or you can give us a call at 318-828-1450. Thank you again for Function First.